I worked as a registered nurse in emergency mental health and mental health crisis for 5 years. I saw people at their worst, broken down and unwell. After years of working with those in crisis, I realized that I had always been at the end of their downward spiral into illness, and I wanted to do something to help people before they got to that point. So I was excited when I got a job as a mental health nurse with a PCN. When I first started, we had a social worker on staff, and if anyone needed connections to community resources, I could easily refer them to her. But after some restructuring, I no longer had access to a social worker, and being in a small town, I had no choice. I had to start supporting people's mental health in a more holistic way. Not long after, a patient was referred to me by her family doctor to work on her anxiety. The first time we spoke, I remember her saying, "I just need to get back on my feet." Her voice was shaky and apologetic. She sounded completely overwhelmed. From a mental health perspective, I knew right away that I needed to work with her on her self-esteem and confidence. But as our conversation continued, I discovered that she needed housing, employment, and food. I realized that for her to become healthy mentally, we needed to address these basic life needs. We had to start at the bottom of the pyramid. Her anxiety was not the problem. It was only a symptom of greater needs. It took 3 months of conversations and emails before she started making phone calls. Together, we had to increase her confidence and capitalize on her abilities before she could make those calls. She needed to find her voice again before she could pick up the phone. I continued to remind her of her capability and resilience in our bi-weekly phone calls. And 7 months on, she started our scheduled call by saying, "I have some good news." I could hear the smile on her face as she described her new part-time job that she loved. After many ups and downs and setbacks, she had finally found herself an apartment and was accessing the food bank. I couldn't help but think back to her voice during that first call as her positivity and optimism washed over me. The call ended with her saying, "I feel so blessed." A year after our first call, she phoned to let me know that she was asked to come on full-time with her new job. She could barely contain her excitement. Now, we speak once a month, and the sound of desperation in her voice is gone. She no longer needs me to tell her that she is capable or that she's okay. She feels it within herself. Supporting people's mental health includes addressing the social determinants of their health. I've learned that my role is not about fixing people's problems. It's about asking the right questions and then empowering them to find the solutions for themselves.